Chris Boucher, the Director of Major Gifts and Campaign at the Lana Health Sciences Foundation, and it is my absolute pleasure to welcome you to the opening of the Shirley and Albert Stevens Health Sciences Library. Along with our very special guest, Ab Stevens, I would like to acknowledge his many family and friends who have joined us today. Thank you very much for being here to help celebrate this very, very special occasion. I would also like to acknowledge the hospital's senior leadership and the doctors and staff from the Health Sciences Center, as well as members from our foundation. Welcome. Now I would like to call upon one of our foundation's board members to tell us a little bit about the wonderful gift that has brought us all here today. Besides volunteering as a member of the London Health Sciences Foundation Board, Dr. Akira Sugimoto is a gynecologic oncologist at LHSC. And like many of our physicians at LHSC, he is not only active as a clinician and a researcher, he is also helping train our future caregivers. Dr. Sugimoto is an associate professor in the Division of Gynecologic Oncology and the Department of Obstetrics and Gynecology at the University of Western Ontario. Dr. Akira Sugimoto.
I'm representing the foundation board. I have to say I do not consider myself of the same ilk as the qualified other people who sit on the board and run the foundation. I consider myself more of a token physician representative, but I volunteer for the foundation board because I believe in the spirit of healthcare, and I believe that our healthcare system requires donations from the private sector these days, and I believe in that, in supporting those initiatives. But I'm going to make some comments to you as a physician, and I just asked my colleague, Dr. Lowney, if he was going to speak. And Steve, I just wanted to make some comments to Ab and his family and friends. And first of all, I wanted to welcome everybody to the hospital, an awkward place to have to meet, an even more awkward place to have to come for care. What I will start with is just a bit of the story about that probably most of you know, and there I go again. We'll get that in a second. But the story that most of you who know Ab already know about Shirley and the kind of trouble that Shirley found herself in and the kind of care that she required and received from Steve Lowney's team, the neurosurgical team. And then subsequent to that, Ab's very thoughtful and caring approach to the foundation with a donation. And I think, you know, something that was news to me as a physician, or a surprise to me, is just how much dollars and cents actually matter to the hospital and how the business of running the foundation is about dollars and cents. But when I got a chance to meet Ab, and actually it was right here, over an open house that the foundation had not very long ago, and we found out that we know some other people in common. But Ab's story was so compelling. The story about Shirley, and the word everything is the word that you used to describe what Shirley meant to you the other day. And I think any of you who know Ab and Shirley probably are well aware of that. Their relationship was one that many people can only dream about. And in particular, what Ab said to me was that he had hoped that, I asked him, you know, why the library? That's sort of an interesting thing to sort of consider. And of course he told me the story about Shirley's, not only her love of books and reading, but her love of the library as a place to read and as a place to find books. And so as you get a chance to tour the library, of course you'll see the space there, and there's an area with a couple of chairs and a small table and a beautiful photo of Ab and Shirley from years gone by. But you know, you can certainly see the nature of their relationship and their character in the photograph. And then there's some artwork from your home. And Ab's not a man of many words, and I hope you don't mind me sharing this, but I mean, we hope that the spirit of Shirley will live on through his donation, but in particular in this library. And so with that backdrop, what I wanted to share with you is how important inspiration is for physicians. You cannot become an effective care provider with education alone. You can't become an effective surgeon. You can't look after patients with education alone. It takes inspiration. And the inspiration that young doctors and even experienced physicians need to find comes from many different sources. But for many of us spending long hours in libraries studying, that kind of very quiet and serene and peaceful environment is a place where we found some of our inspiration. And as you sit in a library, as many of you know, libraries are oftentimes places of history that have been around for a while. And when you're in a hospital library, you think about that's a place of learning or study or inspiration or quiet thoughtfulness that is shared amongst senior and junior and even neophyte medical learners. So what I wanted to say to you today, Ab, is that the doors to this library have just opened. So there isn't a lot of history now to this very new and delightful sort of space. But there will be. And the students that are starting to spend time in the library today will come back to that library 5 years from now, 10 years from now, 20 years from now, as they're looking after patients and being inspired. They will think back to the places where they found their inspiration. And the photo of you and Shirley on the wall is very important. I knew about the Stevens Library long before I'd heard about who Mr. Stevens was. And I didn't know what the story was. And I am so thankful to have had an opportunity to get to know what the story is. I guess that's one of the gifts that comes with being on the foundation board. And I just want to tell you that the story of you and Shirley and her love of books and her spirit and your generosity, and in particular the extension of your relationship with her is sort of embodied with the donation of the hospital to create the library. That's a story that we'll tell to people. Who's the couple on the wall? Why are they here? And who is Mr. Stevens? And that story is going to be there forever. And that's our, I suppose, the only way that in our sort of humbleness that we can sort of pay tribute to both you and Shirley. And that comes very sort of soundly through being in that space. And I think it's wonderful that it's a quiet, serene place to pay tribute to such an important relationship and woman and man. So on behalf of the Foundation Board, the Foundation and the Foundation Board are very, very familiar with the town and Gowan about thanking people and stewarding donations. And the business of raising money for healthcare today is a very, very serious business. It's as much accounting as it is anything else. And it's an incredibly complex art with some very, very qualified people. But at its core root, every one of the people who's counting dollars or measuring or seeking or making phone calls cares in the same way about healthcare. And I just wanted to provide for people in the audience, for those of you that are so close to Ab, from the physician's perspective, I guess one advantage that we have is that we can appreciate the library without really having to think about the dollars and cents. But I do know that it was a very substantial amount of funding that was required and that was given by yourself. And to me, after hearing the story of your relationship with Shirley, it completely reflects the depth of your relationship with her. So we will honor your relationship with her and honor her as a person and honor you by thinking about both of you whenever we're in the library seeking inspiration and learning. But thank you very much, Ab, and thank you to all of you for coming, and I hope you have an opportunity to take a moment to be inspired by Ab and by Shirley and by the relationship this afternoon when you go into the library. Thank you.
Thanks very much, Garrett. I would now like to call on London Health Sciences Vice President of Professional Practice and Chief Nursing Executive, Dr. Vanessa Brakowski, to tell us more about what this outstanding gift will mean to LHSC.
Thank you, Chris. Bonnie Adamson, our CEO here at London Health Sciences, was unable to be with you this afternoon and sends her sincere appreciation to Ab and to Shirley for their generous support. Ab and Shirley's desire to help families at the hospital has come to fruition. They are supporting a caring and dedicated team at the hospital. Their gift helps London Health Sciences Centre provide the best of care for its patients while innovating for the world. Our physicians, nurses, and staff at London Health Sciences Centre provide outstanding, compassionate care for our patients every day, and I would like to thank them for this dedication. But they would not be able to make a difference such as this if it were not for people like the Stevens that step forward to support our organization. While our provincial government pays for the operating costs of our hospital, the majority of new construction costs are relied on from community support, and our local share is necessary for redevelopment, for the purchase of specialized equipment, and to help fund the leading-edge research conducted at London Health Sciences Centre. Without the best tools and facilities, we would not be able to make discoveries or develop innovative medical procedures that benefit people far beyond our region. And we would not be able to deliver compassionate care at the highest level, which our patients experience every day. On behalf of our physicians, nurses, and staff, I would like to express our deepest thanks for the generous donors of the Stevenson family and their contribution to our hospital, because the gift that they have provided to our organization makes a difference to our patients. In particular, I want to thank Ab so much for caring to take that moment to walk into the foundation office and make that wonderful donation. Now let me share with you a bit about the North Tower and one of the programs that now lives there. The North Tower is home to more than 17 different care programs, including medical imaging, nuclear medicine, adult, adolescent, and children's acute mental health, the London Laboratory Services, IV therapy, ear, nose, and throat, and many others. Among those programs are the Grace Donnelly Women's Health Pavilion and Children's Hospital. These programs help make the North Tower one of the most unique healthcare facilities in Canada and indeed in North America. They unite physicians, nurses, and other healthcare professionals specializing in women's and children's health under one roof, fostering collaboration and synergy, resulting in enhanced patient and family-centered care. The Grace Donnelly Women's Health Pavilion provides care for women across southwestern Ontario and will see an estimated 78,000 patients each year and more than 350 visits to the facility's clinics daily. Healthcare providers such as family physicians, midwives, obstetricians, and neonatologists are working together to offer patient and family-centered care. The birthing center can accommodate approximately 6,000 births annually, and family involvement and participation is encouraged in the birthing process. The gynecology inpatient unit provides care to women who require medical and surgical intervention for cancerous and non-cancerous conditions related to the reproductive or urologic systems. This unit is home to an interdisciplinary care team, including physicians, nurses, physiotherapists, and social workers. The Women's Ambulatory Care Unit provides services in the areas of cervical disease, general obstetrics, gynecology, gynecology-oncology, and urogynecology. The obstetrical area includes maternal-fetal medicine, prenatal diagnosis, genetics, and fertility. Throughout the Grace Donnelly Women's Health Pavilion, medical teams have laboratories close by and the ability to quickly consult with specialists in many fields of women's health. With London Laboratory Services Group consolidated in 37,500 square feet of space in the tower, we have access to the most comprehensive collection of state-of-the-art specialty labs of any hospital in the province. If specialists need to be involved in a case, they are close at hand to add to the management of a patient's care for the best possible outcome. However, this building is even more than the sum of its medical resources and the caring physicians, nurses, and staff that it holds. We have built a legacy, an inviting, non-threatening, safe, peaceful place that will minimize any stress that comes from going to the hospital. Patient rooms are strategically located around the building's perimeter, allowing natural light, an important element of healing, to enter through large windows. The atrium also provides a healing environment flooded with natural light where patients, families, and caregivers can relax and recharge. As you see, Ab, the North Tower, which your gift supports, is a place for the best family-centered care. Shirley's desire to help families and your caring today will continue to live in the North Tower, positively affecting the lives of families across our region for years to come. Ab, thank you for seeing your conversations with Shirley through. Your gift has and continues to make such a difference in the lives of patients. Thank you.
Thank you, Dr. Borkowski. While the Stevens gift will benefit patient care in the North Tower, as you know, it is this library that will bear the Stevens name. Libraries like this are important resources for physicians and staff when it comes to ensuring our patients receive the best possible care. Health Sciences Library Manager Carla Van Kessel has been at LHSC since 2005. She is here to tell us about the Shirley and Albert Stevens Health Sciences Library and what it means to the hospital. Carla?
Thank you, Chris. The library at LHSC is a center of excellence that links clinicians, researchers, and administrators to published evidence through client-focused relationships and strategic partnerships. In LHSC's fast-paced environment, and in a world where research is published on an hourly basis, the library team works with clinicians and researchers to find the best available evidence to support daily decisions in the hospital. For many years, we have heard from our clients that they loved our professional services, but that they desired a space where they could work in peace and tranquility. They desired a refuge from their hectic days in their labs, at the patient's bedside, and in non-stop meetings. The Shirley and Albert Stevens Library is that place. Now we can offer 24-hour, comfortable space for residents to study for exams, for nurses and doctors to use computers for research, for administration to hold meetings and instructional sessions. It has only been a few months since moving into the Shirley and Albert Stevens Library, and the buzz is palpable. Everyone loves this space. Today I'm so excited to showcase the work that is done in the Shirley and Albert Stevens Library. When you walk through the doors of the library, you'll notice the beauty of the bright, open space. There are 5 different stations to help you understand the kind of work being done by the library team. I hope you find the displays interesting and thought-provoking. My team of 9 will be available to guide you and answer any questions you may have. Last week, I had the honor of meeting Mr. Stevens in the library. He likes to be called Ab. He told me why he and Shirley had decided to give a gift to the hospital. He told me it was Shirley's love of learning that made him choose the library as the recipient. It was such a pleasure to understand the history of their gift, so that it is much, much more than just names on a plaque. On behalf of the library team, I would like to say how thankful we are for your generosity. I would also like to express how pleased we are that this space has your name attached to it. You are a kind and gentle soul, Mr. Stevens, and these qualities are reflected in the space that has been created. Thank you very much.
Thank you, Carla. Vanessa told us how the North Tower was designed to help physicians, nurses, and staff provide the best possible care to patients and their families. She also told us that donors are key to enabling that care. We would like to share with you a short video presentation that shows you an example of how donors and their generous gifts can positively affect one patient and her family at LHSC.
So they called, the ambulance came to get me, and they rushed me to University Hospital. My name is Lisa Bastiani. February 27, 2011, I had Livia, and at the same time I had an aortic dissection.
So a CT scan was performed. The CT scan showed a tear in her aorta. This is a very critical condition. I'm Rigo. I'm a cardiac surgeon at University Hospital, London Health Science Center.
Well, the risk of the baby is intrauterine death if mother isn't helped. If mother were to die suddenly, then the baby would die as well.
So we made the decision to carry out a concomitant cesarean section and repair of type A aortic dissection.
In this situation, we felt that the situation was so grave for Lisa that we thought that anything that we might do surgically in the abdomen might cause some problems in the heart, and so we thought that we should be ready from a heart point of view.
So when we finished opening the chest and preparing the growing vessels, cesarean section was performed. Our healthy baby girl was delivered from there.
The safe arrival of Livia now accomplished, the two teams worked together over the next 7 hours.
At one point, we were holding her uterus to keep it from bleeding, and at the same time, the cardiovascular surgeons were holding her heart and her major blood vessel and repairing it. I felt that we were on a frontier, that we were doing something that was not the usual thing that we do. And at the same time, I felt confident.
A unique case, something never done before, but the expertise and the resources are here, available to all of us should we need them.
The experience that I had that day made me even more proud of the healthcare system that we have in our city.
It's your support that enables London Health Sciences Centre to enhance and advance the standard of care for the region.
Donor dollars, they are very important. They are probably one of the important source of financing this institute.
Donor dollars allow us to provide better laboratories, better instrumentation, better teaching, so that we can be excellent in all areas of medicine.
As hard as everything has been, I'm still here. The bottom line is I'm still here, and that's because of them. Just thank you. They all did such great stuff for me.
It is this level of patient care that we strive to achieve at London Health Sciences Centre. Good afternoon, I'm Simona Dobransky, a development officer at the Foundation. It's been my pleasure to meet and work with Ab over the past few months while the North Tower and Shirley and Albert Stevens Health Sciences Library was being completed. I'm so very happy to be here today and to have a small part of this wonderful opening. As we conclude today our formal program, I would like to say thank you once more to Ab on behalf of London Health Sciences Foundation. It is simply heartwarming to see such a philanthropic act. Ab, you didn't seek public recognition. You simply wanted to make a difference. And when you walked into the foundation, it was a moment that has touched us all deeply. And it is a moment that continues to change the lives of many patients and their families. Thank you. And thank you to everybody to being here today and share this happy occasion. We are now going to take some photographs at the Stevens Library Park, followed by a tour of the library. I would now like to ask the following people to gather here at the front to my left, please, where we will proceed to the West Library entrance for photographs. So those people are, please, Dr. Burkowski, Steve Lamy, Dr. Sugimata, Chris Bouchette. May I ask everybody else to give us a few moments for these photos. Then when the doors on my right are opened, proceed to the library and Carla's library staff are on hand to show you this wonderful new facility. Also, if you get our parking passes, please use them as a payment after you enter your parking ticket. Thank you so much.